Well, that's when we discuss surgery. So I'll just give a brief overview of the types of treatments that we offer. So surgical treatment for scoliosis, the gold standard is still a posterior spinal fusion. And a spinal fusion means that we take all of the different motion segments in the spine and we fuse them together surgically. So instead of working like many different bones, it works like one bone. And so our goals, number one, are to get your child through the operation safely. We want to prevent progression later on in life so that we set you on a better trajectory. And we try to obtain as much correction as we can safely to straighten out the curve. And so this is a treatment that's been developed over many years, and it's very safe and very routine in high volume hospitals. Patients usually stay about 3 days in the hospital, sometimes less, occasionally a little bit more. You take a few weeks off of school to recover. You're back to most activities at 6 weeks, and it can vary depending on your surgeon and the type of operation that you have, but you're mostly back to high impact sports with no restrictions, somewhere between 3 and 6 months. The complication rate, thankfully, is very, very low. We take it very seriously. No one wants to sign their child up for something that risks any complications, but there is a complication risk with every surgery, but thankfully, with posterior spinal fusion, it's very low. But there are some new treatments that have come onto the market that are important for people, families who have scoliosis, to be aware of. So the US FDA has conditionally approved through something called a humanitarian device exemption, 2 different treatments, surgical treatments for scoliosis that do not necessarily involve fusion. First is called anterior vertebral body tethering, which involves approaching the spine through the chest and placing screws sideways. And instead of putting a rigid rod and fusing the spine, we put a flexible rope or a tether in, which asymmetrically limits growth. So as a child continues growing, the scoliosis can straighten out. And in an ideal world, the motion is retained. Another example is something called posterior dynamic distraction, which the FDA approved in the same year under this humanitarian device exemption. And that is a device which we implant through the back, similar to a spinal fusion, but we don't expose the entirety of the spine. And it essentially functions as an internal brace, where we, instead of limiting the growth on the convexity, the outside of a curve, we actually prop up the concavity or the inside of the curve and straighten out the spine after that. And then after that's done, then some patients are having these devices removed and some patients will retain them. Both of these devices are very young, and these techniques are very young compared to a spinal fusion. And so we're still learning about who might benefit from them, and we're better understanding their risk profile in the context of the established treatment of spinal fusion. So for most patients, they're not really the best option, but they might be for some patients. And so some families are very interested in learning more about them. So in summary, this is kind of a brief whirlwind tour of scoliosis, but I think it's good even for families that might be signed up for this kind of a webinar, because, when I'm taking care of a kid with scoliosis, the way the system works, I have a very brief amount of time to give such a large volume of information to families.